In this video, we will be discussing arrhythmia. We'll cover its causes, risk factors, and common triggers, as well as explore how arrhythmias are classified and diagnosed. We'll also touch on the various treatment options available and outline the patient care process, providing a comprehensive overview to help you understand this important cardiac condition. So what is arrhythmia? So, arrhythmia refers to the abnormality in the heart's rhythm which can lead to disruptions in its normal beating pattern. It is a broad term that encompasses various conditions where the heart may beat too fast, too slow, or irregularly. So, sa arrhythmia, nagkakaroon ng problem yung electric signals ng heart na nagko-control ng beat. Because of this, pwedeng fast ang heartbeat or tachycardia or pwede namang slow or bradycardia. So, let's proceed to its etiology. So the first one is heart conditions in where coronary artery disease, heart failure, heart valve disorder, and cardiomyopathy can lead to arrhythmia. Second one is electrolyte imbalance. Abnormal levels of potassium, sodium, calcium, or magnesium can disrupt the heart's electrical impulses. Third one is medications. Certain drugs such as beta blockers or antiarrhythmic medication may induce arrhythmias. So the fourth one is the congenital heart defects where structural issues present at the birth can cause arrhythmias. Fifth is the stress and anxiety. High levels of stress or emotional triggers can lead to irregular heart rhythms. Sixth one is substance abuse. Excessive alcohol, caffeine, nicotine, or drug abuse such as stimulants can also trigger arrhythmias. With the thyroid issues, overactive or underactive thyroid can affect heart rhythm. For infection or inflammation, conditions like myocarditis can lead to arrhythmias. And lastly, genetics, inherited conditions like long QT syndrome can increase the risk of arrhythmias. For the risk factors, number one is age. Arrhythmia risk might increase with age due to the changes in the heart, such as scarring and the consequences of other chronic illnesses. Second one is lifestyle habits. Your risk of arrhythmias may be higher if you smoke, use illegal drugs such as cocaine or amphetamines, or drink alcohol more often and more than is recommended. Third one is family history or genetics. Arrhythmias can run in families. You may have increased risk of some types of arrhythmias if a parent or other close relative has arrhythmia. Fourth one is arrhythmias can occasionally result from medications your doctor gives for other health conditions. For certain individuals, arrhythmias may also be more likely after using a certain antibiotics and other the over-the-counter medication for allergies and colds. Next one is chemical agents in where different kinds of chemical agents can cause arrhythmias, sometimes with serious consequences. Minerals such as potassium, magnesium, and calcium, they play a vital role in the heart's normal function. And lastly, for the risk factors is other conditions. Other conditions can also place you at an increased risk for an arrhythmia including diabetes, chronic lung disease, pulmonary embolism, which is a clot that develops in the lungs, emphysema, which is a disorder of the lungs, asthma, sleep apnea, thyroid disorder, high blood pressure, chemical imbalance that can occur due to the lack of potassium, magnesium, calcium, or other chemicals in the body necessary for maintaining a regular heart rhythm. So, let's proceed naman sa triggers ng arrhythmia. So, triggers of arrhythmia are factors that can lead to or worsen abnormal heart rhythms. Recognizing these triggers is essential for effective management at saka prevention ng arrhythmia episodes. So, first one is heart-related issues. So, conditions like heart attack, damaged tissue, and congenital heart defects can disrupt the heart's electric signals. Example, dito sa heart attack, di ba? Pag nagkakaroon tayo ng heart attack, nasisira ang heart tissues. So, ang big sabihin dun, kapag nagkakaroon ng heart attack, nagkakaroon din ng problema sa electrical pathway ng puso. Dito naman sa damaged heart tissues, di ba, may mga, ano ba tawag dun? May mga peklat tayo sa mga past surgery, ganon. O kaya, condition natin dati. parang pwede yung mag-cause sa normal na daloy ng electric impulses. Dito naman sa congenital heart defects is parang yung mga abnormalities mo from pagkabata, pwede siyang maka-affect sa electrical system ng puso. So, dito naman tayo sa lifestyle factors like smoking, excessive alcohol or caffeine intake, and drug abuse can increase the risk. So, dito sa smoking, yung nicotine at iba pang chemicals sa sigarilyo ay pwedeng makapagpataas ng heart rate natin at ng blood pressure, na pwedeng mag-cause ng arrhythmia. Sa excessive alcohol naman is yung sobrang pag-inom ng alak ay pwede ring makabago ng pwede rin siya maka-affect sa electric impulse ng puso natin. Dito naman sa caffeine, yung maraming pag-take mo ng coffee is pwedeng makapag-cause ng pag-overstimulate ng puso na pwedeng mag-trigger at pwedeng maging irregular heartbeat natin. So let's proceed naman sa medical conditions. High blood pressure, diabetes, thyroid problems, and electrical imbalance like low potassium or magnesium are significant triggers. Gaya na lang sa high blood pressure, ito ay pwedeng mag-cause ng pagtiken ng walls ng heart at pwedeng mabago nun yung pagdaloy ng electrical signals. Sa diabetes naman, yung mataas ng blood sugar levels ay pwedeng maka-cause ng pag-iba ng electrical system ng puso. Sa thyroid problems naman is yung hyperthyroidism, yung overactive thyroid, at hypothyroidism, yung underactive thyroidism, ay pwede ring mag-cause ng arrhythmia. Sa electrolyte imbalance naman ay yung low potassium, magnesium, or calcium ay pwedeng maka-affect rin sa electric impulse ng puso. So, fourth one is medication. So, sa medication naman, yung certain medications including those for high blood pressure and mental conditions can cause arrhythmia. At kahit yung mga over-the-counter na colds or allergy medication ay pwede rin maka-affect sa electric signals ng puso at pwedeng magkaroon ng arrhythmia. So, stress and emotions naman, yung emotional stress, anxiety, and sudden surprises can trigger arrhythmia. Sa emotional stress naman, yung sobrang stress mo, tas anxiety ka pa, ay pwedeng makapagpataas ng adrenaline na nagiging sanhi yun ng irregular heartbeat natin. Sa sudden surprises naman, yung biglang pagkagulat ay pwede rin magdulot ng adrenaline na sanhi ng irregular heartbeat. So sa physical factors naman tayo, dehydration, low blood sugar, and vigorous physical activity can also be triggers. Like sa dehydration, yung kakulangan natin sa fluid sa body natin, pwedeng magdulot yun ng electrolyte imbalance na pwedeng maka-affect rin ng electrical activity ng puso. So, low blood sugar naman is yung hypoglycemia ay pwedeng mag-cause ng irregular na tibok ng puso. Yung sa vigorous physical activity naman is yung pag-intense yung exercise mo ay pwedeng mag-overstimulate yung puso. Lalo na kung hindi ka naman sanay. So, pag nag-exercise ka, dapat start moderate lang. So, punta naman tayo sa pathophysiology ng arrhythmia. So, may key components ang heart electrical system, which is the SA node, AV node, and bundle of His and Purkinje fibers. So, punta muna tayo sa SA node, the heart's natural pacemaker located in the right atrium. This initiates electrical impulses that spread through the atria and signal the heart to contract. So, sa AV node naman is, this acts as a relay station slowing down the electrical signals before it reaches the ventricles. This also ensures the ventricles fill properly with blood before contracting. So, sa bundle of His and Purkinje fibers naman is, they transmit the electrical signal from the AV node to the ventricles, ensuring coordinated contraction of the heart muscle. So, let's proceed naman sa classification of the disease. Mahati ito sa dalawa, yung abnormal heart pulse formation, tsaka abnormal heart pulse conduction. So, dito muna tayo sa abnormal heart pulse formation. So, sa number 1 is yung sinus arrhythmia. Ibig sabihin dito, yung heart natural pacemaker, which is the sinus node, pwede siyang mag-cause ng irregular heartbeat na pwedeng rin ng pag-iiba ng paghinga natin. Dito naman sa atrial arrhythmia, yung abnormal na electrical signals na nag-start sa atria, nagli-lead siya sa irregular heartbeat. Next one is the atrioventricular junctional arrhythmia, which is yung electrical signals na nag-originate near or at the atrioventricular junction, nagdi-disrupt siya sa normal rhythm ng heart natin. And yung sa ventricular arrhythmia naman is yung irregular signals begin in the ventricles, which is sa baba, leading to fast or abnormal heartbeats. So sa next naman is yung abnormal heart pulse conduction. May apat siya. First one is sinus atrial block. Dito, yung signal from the sinus node is delayed or blocked before reaching the atria. Next one is intra-atrial block, which is yung electrical impulses are blocked or delayed within the atria, affecting yung normal rhythm ng heart natin. Next one is the atrioventricular block. Dito naman, yung signal between the atria and ventricles is slowed or blocked, kaya na-affect yung heart coordination natin. And lastly, for the abnormal heart pulse conduction, yung intraventricular block, which is yung electric signals are delayed or blocked within ventricles, impairing their function. So let's proceed naman sa diagnosis ng arrhythmia. So, when it comes to diagnosing heart conditions, especially sa mga irregular heartbeats or arrhythmias, may mga various tests and procedure na ginagawa ng mga healthcare professionals. Kumbaga, yung mga tests na to is nag-help siya sa pag-identify ng mga issues sa heart electrical activity, blood flow, and overall structure, which is very crucial sa proper treatment and management ng heart disease. So, let's proceed sa number 1, which is electrocardiogram, ECG or AKG. So dito naman, isa siyang mabilis na test sa pag-measure ng electrical activity ng heart. Parang dito mapapakita kung gaano kabilis or gaano kabagal yung beating ng heart natin. So sticky patches called sensors are attached to the chest and sometimes to the arm or legs. Wires connect the patch to a computer which display or prints the result. Next one naman is yung Holter monitor. So this portable ECG device can be worn for a day or more to record the heart activities during daily activities. So next one naman is yung event recorder. So this portable ECG device is worn up to 30 days or until arrhythmia or symptoms occur. So bali dito, ano siya, parang i-click mo lang siya once na naramdaman mo yung symptoms, ganon. So next one naman is echocardiogram. So this test uses a sound waves to take pictures of the beating of the heart. It can show the structure of the heart and the heart valves. It can also measure the strength of the heart. Pwedeng mapakita dito yung how blood flows through the heart. And lastly, sa implantable loop recorder naman, if symptoms are very infrequent, an event recorder may be implanted under the skin in the chest area. The device continuously records the heart electrical activity. It can find irregular heart rhythms. Dito naman sa next is may mga tests rin pero ginagamit lang to if an irregular heartbeat isn't found during initial tests. More tests can be suggested to trigger the arrhythmia like stress tests. So, some arrhythmias are triggered or worsened by exercise. During a stress test, the heart's activity is watched while you ride on a stationary bicycle or walk on a treadmill. If you can't exercise, you may be given medicine that affects the heart in a way that's similar to the exercise. So dito naman sa tilt table test, this test may be done if you had fainting spells. So yung heart rate at blood pressure mo are checked habang nakahiga ka sa table. So yung table is natitilt to put you in a standing position. So a healthcare professional watches you how your heart and nervous system respond to the change in angle. Next one naman is yung electrophysiological, which is EP. This test is also called This test is also called an EP study, which nako-confirm yung diagnosis of tachycardia or find out where in the heart the faulty signaling occurs. So, yung EP study is mostly used siya sa diagnose ng isolated arrhythmia. So, an EP study is done in the hospital. One or more thin flexible tubes are guided through a blood vessel, usually in the groin, to various areas in the heart. Sensors on the tips of the tube records the heart electrical activity. An EP study shows how electrical signals spread through the heart during each heartbeat. So, dito sa next slide, makikita natin yung mga different tests. Yung ECG, event recorder, echocardiogram, Holter monitor, implantable loop recorder, stress test, at saka tilt table test.
For the pharmacologic treatments of arrhythmia, we have the antiarrhythmic drugs. Under this, we have four classifications of antiarrhythmic drugs. First is the class 1 or the sodium channel blockers, which has three categories: the class 1A, class 1B, and the class 1C. Second is the class 2, which is the beta blockers, the class 3 potassium channel blockers, and lastly the class 4 calcium channel blockers. For the sodium channel blockers, we have the class 1A. Under these are the drugs quinidine, procainamide, and the dispyramide. So the effect of class 1A is it slows phase zero depolarization, it prolongs action potential, hence an increase in the refractory period. It also prolongs QT interval, which means an increase in the QRS duration. And lastly, it also slows down conduction velocity. However, class 1A promotes cardiac arrhythmias, so they are no longer used for the treatment and management of arrhythmia. Still under the sodium channel blockers is the class 1B. Under this are the drugs lidocaine and mixelitine. Class 1B exert its effect by shortening action potential, which means a decrease in the refractory period, and it has also no effect on conduction velocity. And lastly, it has more pronounced effect in ischemic tissues than on non-ischemic tissues. For the class 1C, we have the drugs flecainide and propafenone. So class 1C's effect is it slows phase zero depolarization. It also has no or minimal effect on action potential duration, and it also slows conduction velocity. For the class 2 of the antiarrhythmic drugs, we have the beta blockers. That includes the drugs esmolol, metoprolol, propranolol, and the others. So the effect of class 2 is it delays slope of phase 4 in the sinoatrial node. It also prolongs repolarization in the atrioventricular node, therefore a decrease in the AV node conduction velocity. And lastly, it has a negative chronotropy and dromotropy. And also, this classification of antiarrhythmic drugs is usually used for the management of atrial fibrillation arrhythmia. Class 3 of the antiarrhythmic drugs are the potassium channel blockers, which includes the drugs amiodarone, dronadarone, sotalol, dofetilide, and ibutylide. So the effect of class 3 is it prolongs ventricular action potential, hence there is an increase in the refractory period. Lastly, under the antiarrhythmic drugs is the class 4, which is the calcium channel blockers. Under these are verapamil and diltiazem. So, ang effect naman ng class 4 is it prolongs repolarization. Hence, there is a decrease in the atrioventricular node conduction velocity. And also, it has negative inotropy and little effect on SA node and heart rate. So, this classification of antiarrhythmic drugs are usually used for the treatment or management of acute fibrillation and acute supraventricular tachycardia. So, this table presents the pharmacokinetics of selected or some of the few antiarrhythmic drugs. This includes the drug itself, its oral absorption, its percentage protein binding, including its elimination, metabolism, and the half-life, and also the therapeutic range if recommended to be measured. The table presented here is the adverse effects of class 1 antiarrhythmic drugs. This includes the drug, its adverse effects in the heart or the cardiac, and also its non-cardiac adverse effects, and also yung precaution or caution or what to avoid when taking the medication or the drug. Similar to the previous table in the previous slide, this table presents the adverse effects of antiarrhythmic drugs that belongs to class 2, class 3, and class 4 antiarrhythmic drugs. This also includes the drug itself, their adverse effects in the heart or the cardiac adverse effects, and also non-cardiac adverse effects of the drugs. And additionally, the warning or precaution or what to avoid when taking the medication. Non-pharmacologic treatment for arrhythmia includes therapies, surgeries, and lastly, lifestyle modification. For the therapies, we have two. First is the vagal maneuvers. These are simple but specific actions that can slow down the heart rate. This includes coughing, bearing down as if having a bowel movement, and putting an ice pack on the face. These actions affect the vagus nerve wherein the nerve helps control the heartbeat. Vagal maneuvers may be recommended if you have a very fast heartbeat due to supraventricular tachycardia. However, vagal maneuvers don't work for all types of arrhythmias. And second and the last one is the cardioversion. These are paddles or patches on the chest that are used to give an electrical shock to the heart and help reset the heart rhythm. This is typically used when vagal maneuvers and medicines don't work for the patient. The healthcare team may recommend this treatment if you have a certain type of arrhythmia such as atrial fibrillation. Treatment for heart arrhythmias may also involve a procedure or surgery to place a heart device in the patient's body. Types of procedures and surgeries used to treat heart arrhythmias include catheter ablation, pacemaker, implantable cardioverter defibrillator or the ICD, maze procedure, and lastly the coronary bypass graft surgery. So for the catheter ablation, the doctor places one or more catheters into the blood vessels up to the heart. Sensors at the catheter tips use heat or cold energy to create tiny scars in the patient's heart. The scars block irregular heart signals and restore the heartbeat. Next is the pacemaker. If slow heartbeats don't have a cause that can be fixed, a pacemaker may be needed. A pacemaker is a small device that's placed in the chest of the patient to help control the heartbeat. Next is the implantable cardioverter defibrillator or the ICD. This device is placed under the skin near the collarbone. This continuously checks the heart rhythm of the patient. So if the device finds an irregular heartbeat, it sends out low or high energy shocks to reset the heart's rhythm. This device is needed if the patient has a high risk of dangerously fast or irregular heartbeats in the lower heart chambers. These conditions are called ventricular tachycardia or ventricular fibrillation. For the maze procedure, a surgeon makes tiny cuts in the upper half of the heart to create a pattern of scar tissue. This pattern is called a maze. The heart signal can pass through scar tissues, so this treatment can block stray electrical heart signals that cause some types of fast heartbeats. The maze procedure is usually done if the patient don't get doesn't get better with other treatments or if the patient had already an open heart surgery for another reason. And lastly, the coronary bypass graft surgery. If the patient have severe coronary artery disease with an irregular heartbeat, this type of heart surgery is needed or recommended. The surgery creates a new path for blood to flow around a blocked or partially blocked artery in the heart. Lastly, in the non-pharmacologic treatment for arrhythmia is the lifestyle modification. So first here is eating a heart-healthy foods. So advise the patient to eat a healthy diet that's low in salt and solid fats and rich in fruits, vegetables, and whole grains. Next is getting a regular exercise. So, also advise the patient to exercise for at least 30 minutes on most of the days. Next is the quit smoking or don't smoke. So, if the patient smokes and can quit on his or her own, recommend the patient to talk to a healthcare professional about strategies or programs to help the patient with this problem. Next is maintain a healthy weight. So, being overweight increases the risk of heart disease. Therefore, set realistic goals for body mass index and weight. Control blood pressure and cholesterol. High blood pressure and high cholesterol increases the risk of heart disease. So make lifestyle changes and take medicines as directed to manage high blood pressure or high cholesterol. For the limit alcohol consumption, advise the patient to drink alcohol moderately. For healthy adults, that means up to one drink a day for women of all ages and men older than age 65 and up to two drinks a day for men ages 65 and younger. For the practice good sleep habits, as we all know, poor sleep may increase the risk of heart disease and other chronic conditions. Thus, adults should aim to get 7 to 9 hours of sleep daily. And lastly is the managing of stress. Managing stress is an important step in keeping the heart healthy. Getting more exercise, practicing mindfulness, and connecting with others in support groups are some of the ways to reduce and manage stress.
The first step in patient care process for arrhythmia is the collect. So dito, i-gather natin lahat ng data or information na makakatulong sa atin and kailangan nating i-consider for the medical or treatment regimen of our patient. Una dito is yung patient characteristics followed by the history of present illness like the signs and symptoms and duration of the patient's symptoms and also patient medical history. And next is the social history including smoking and alcohol use. And also, kailangan din natin i-consider kung gaano kadalas manigarilyo or uminom ng alak si patients. And dietary habits including intake of vitamin K containing foods kasi contraindicated ito sa drug na warfarin which is used in the treatment or management of atrial fibrillation. And next is the current and previous medications ni patient including prescription drugs and over-the-counter drugs, especially the use of aspirin or the non-steroidal anti-inflammatory drugs, and also herbal products and dietary supplements na tinitake ni patients. Under collect, we have to also gather the objective data. This includes the blood pressure, heart rate, height, and weight of the patient. This also includes laboratory tests to be conducted, such as the electrolytes level of the patient, the serum creatinine, hemoglobin, hematocrit, platelets, activated partial thromboplastin time, prothrombin time or the PP, International Normalized Ratio or the INR, and thyroid function tests. And lastly, for the objective data is the 12-lead electrocardiogram and echocardiogram of the patient. Moving on with the second step for the patient care process is the assess. So first is the hemodynamic instability of the patient. Kagaya na lamang ng kailangan yung systolic BP ni patient is less than 90 mmHg. Also, evidence of decompensated heart failure or angina. Next is the duration of symptoms if ito ba ay less than 48 hours or greater than 48 hours or if hindi na na-take note or hindi na maalala ni patient. Next is left ventricular systolic function. This is also to know the left ventricular ejection fraction of the patient. Also yung risk of stroke ni patient which can be measured through the CHA 2DS2 VASC score and also yung risk of bleeding which can be measured through the HAS BLED score or the Hasbled score. Next is the presence of potentially reversible causes of arrhythmia like thyrotoxicosis, alcohol withdrawal, infection, electrolyte abnormalities like hypokalemia, hypomagnesemia, and the like. And also, we need to assess or consider yung capability ni patient or yung willingness niya to pay for anticoagulation treatment options and laboratory monitoring tests such as the prothrombin time or the PT, the INR or the international normalized ratio, serum creatinine, and the like. And lastly, for the assess is the potential drug interactions with rate control medications, anticoagulants, and or antiarrhythmics.
Third step in the patient care process is the planning or plan. So first, we're going to plan the drug therapy regimen for the patient that includes the rate control medications, anticoagulants, and or antiarrhythmic, and as well as the dose, the route of administration, the frequency, and the duration of the medication. Next is the monitoring parameters that includes the efficacy and safety of the medication. So dito, i-check natin or i-monitor natin yung ventricular rate ni patient, including yung prothrombin time or international normalized ratio or the INR kapag nag-administer tayo ng warfarin sa patient. Also, yung signs and symptoms of stroke. And for the safety, kailangan din nating alamin kung ito ba ay nagkukos ng proarrhythmia. And also, kung may sign and symptoms of bleeding. And additionally, yung frequency and timing of follow-up ni patient. And lastly, for the planning is the patient education. So dito, kailangan nating magplano kung paano natin i-advise si patient or i-educate si patient about sa purpose ng kanyang treatment regimen and also yung information ng kanyang mga gamot and also yung pag-follow up niya. And the fourth step is the implement. First here is we should provide patient education regarding all elements of the treatment plan. Next is the use of motivational interviewing and coaching strategies to maximize adherence. And lastly is the scheduling of follow-up and also adherence assessment, bleeding risk assessment, serum digoxin concentration levels, and pertinent laboratory or radiologic tests. Last step is the follow-up or the monitor and evaluate. So, dito need natin i-monitor yung ventricular rate and rhythm ni patients, including yung mga symptoms na nararamdaman niya and also yung presence of adverse effects like bradycardia, bleeding, organ toxicities, and the like. And additionally, yung sa INR ni patient or the International Normalized Ratio. So, bakit nga ba kailangan nating i-monitor yung INR ni patient? This is to know if kailangan ba nating i-adjust yung warfarin dose ni patient to maintain target INR in range of 2 to 3 and to determine time in therapeutic range. So lastly is yung patient adherence sa treatment plan natin.